Hello and welcome to this week's HealthTech Hour on UK Health Radio, the world's biggest and best talk health radio station. My name is Steve Roest, and each week we bring you the best news, views and interviews with the founders, leaders, clinicians and CEOs who are changing the face of healthcare in the UK and beyond. I am a founder and CEO of a health tech company myself called PocDoc. Our mission is to allow anyone with a smartphone and the PocDoc app to give themselves a blood test for major diseases, starting with cardiovascular disease, which is actually quite relevant for today's guest. And that is something that we will come back to in a moment. So as always, before we get to who's on today's show, I want to remind everyone to follow at HealthTech Hour on Instagram and Twitter. Please follow me on Twitter. It's at Steve Roest CEO, and always follow the station, which is at UK Health Radio, to stay on top of all of the other great content that's coming up. We read every message that people send in. So thank you for all of the listeners that have written in. We love the energy. We love the fact that you love the show. We do this for you. So if you have a guest suggestion, if you have an opinion about something that we've talked about, let us know. Tell us. We're always here, and we'll read everything. So on to today's show. Actually, before we go on to today's show, I just would like to apologize because I lost my voice over the weekend, which is why I sound like this. So I understand I don't sound fantastic, but you know, the show must go on. So on today's show, we have Jules Payne, the CEO of Heart UK, which is the UK's only cholesterol charity. Their aim is to save lives by helping people understand what cholesterol is and reducing their risk of cardiovascular disease through healthy living. This is the time of year where people often think about getting healthy after overindulging at Christmas. And coming out of the pandemic, there's obviously been huge disruptions to course of business for healthcare, for all kinds of major conditions, including cardiovascular disease, but also other things like cancer and really across the board, heart conditions, stroke, hypertension. So it's kind of the perfect moment to get someone like Jules to come on the show and to just understand what Heart UK do and what their mission is. So Jules, welcome to the show. How are you?
I'm very well. Thank you very much, Steve, for your lovely welcome. And it's lovely to be here and represent Heart UK on the show today.
Perfect. How are things over at Heart UK? Is this a busy time of year, or is it just kind of always generally quite busy?
It's always busy, always busy. So we never really have any downtime. And you touched on the pandemic there. Our access for our services went up by 73%. During pandemic. Wow. It was huge. Yeah.
That's massive. Well, look, to be honest with you, we could probably do 3 or 4 shows on this, not least of which because this area is obviously quite close to my heart, if you pardon the pun, but also because there's a lot to unpick. So as everyone knows that listens to the show, we generally do it in 3 parts. So there's an origins part, and then there's a middle bit about all of the amazing things that Heart UK are going to be doing. And then there's a sort of a final part, which is more will be, I think, advice to listeners, because the amazing thing about what Jules is doing at Heart UK and cardiovascular disease, heart conditions, stroke, high blood pressure, it affects all of us in some way, shape or form. Whether it's not you yourself right now, I guarantee you it will be an uncle, an aunt, a mother, a father, a grandfather, a grandma. Like cardiovascular disease is the single biggest killer in the UK. So it's relevant for all of us. So yes, I think there's a lot that we can get into. So Jules, so in my experience, people in the not-for-profit sector generally have a very clear reason or a very clear mission or drive or a calling to get into that particular sector. You know, it's something that comes from within. And so what was that for you? Is that true for you? And what was it? And how was your journey into this sector and also into this particular area of heart health and cholesterol?
Yes, thank you. So our absolute reason for being is to save lives, lower cholesterol and save lives, and also keep families together so that we don't see families ripped apart by people dying or having heart attacks and surviving, and actually, you know, the real impact of the heart attack or the stroke on the family. We want to change that. So it is all about prevention. It's all about making sure that we prevent early deaths and disease from cholesterol. And our absolute mission is for people to know and understand their cholesterol and other blood fats, and be taking appropriate action. That's why we exist. And I'm a great believer, Steve, in you know, charities really should only be around while the problem exists. The charities should set themselves up to resolve the issue, and then you don't need the charity anymore. So I'd love to say that you are making everybody redundant at Heart UK, and we don't need the help anymore from all these wonderful volunteers that help us. But actually, unfortunately, we're not in that space quite yet.
Right, and just to be clear, you're not making that announcement on air to all of the people that work for Heart UK. So just we're all clear. It was hypothetical, and
absolutely.
So with you personally, though, because we're going to come on to a little bit, because I think what I want to do before we go too much further in the show is that I think we should come up with just some definitions and baselines of what we're really talking about. You know, with all these words that people hear, probably quite a bit, cholesterol and you know blood pressure and lipids and cardiovascular disease and all this kind of stuff. But for you personally, is this particular area something that was a personal mission for you, which often happens within the not-for-profit sector, or were you just committed to the not-for-profit sector because you wanted to make a difference, or what was your journey as to how you've gotten to this position?
So for me, I always like being a sort of big pebble in the pond, if you like, as opposed to a small pebble in a bigger pond. I like to see the difference that I'm making. And then just getting into working in the charity sector just opened my eyes. And the whole aspects, I worked in allergy previously, and I thought that was a fantastic job. And then I joined Heart UK, and I truly have the best job in the whole wide world. Our cause is a fantastic cause. There's still so much to do. And, you know, we know that we can make a real difference. And I can tell you, when I first arrived, heart was always one of those things that you think, yeah, that would be amazing. Heart or brain, I've always felt, for me personally, two areas that are so interesting, and so much that still can be done, certainly around prevention. That's such a key thing. And actually, from a health perspective, it saves a huge amount of money for the NHS, but what does that mean to the average family? Not a lot, really. What it means is that you keep families together. So for me, actually, it was a story very early on. In fact, I was 1 week into my role at Heart UK, and I read a story, and I was stood in my kitchen, and I feel like I was there. I'm back there now as I'm talking about it. And it was a story about Rhianna Wingett. And Rhianna Wingett's mum knew that she had the inherited form of high cholesterol. So she was asking her GP, when are you going to test my girls? And sadly, the GP said, they'll be fine. I'll test them when they get to their teenage years.
Right.
Unfortunately for Rhianna Wingett, she did a cross-country run at school on the eve of her 12th birthday, and she got back from that run and sadly collapsed on the field and died.
That's tragic.
And her mum was out buying her birthday presents, and they were going to have family celebrations, etc. Now, I read that story, and Rhianna obviously had familial hypercholesterolemia, which is the inherited form of high cholesterol. Now, the family knew that was actually in the family, but they couldn't get the children tested. And that is awful, an awful situation, when I know we've had cancer in my own family, and you know, myself and my sister were offered a huge amount of support from the NHS because of cancer and the genetic form.
Yeah.
But actually, on this side of things, this wasn't happening. And so from that day to this, that story, that family, and I've met the family, they're an amazing family, but they have to live with that every single day. They have to live with somebody missing at their dining table. A piece of their heart has gone, and that shouldn't be happening as far as I'm concerned. So that is absolutely why I do my job. And
it's stories like that, similarly funny. Not the same story at all, but one of the reasons why we started Pop Talk was because my co-founder Kieran, who happens to also be my wife, her father was in his late 50s, early 60s, and went to the doctor, this GP, and proactively said, look, I'm worried about my cholesterol. I've seen lots about it on the news, and you know, I'd like to get a sort of a proactive check. I've heard about these health check type things, and I'd like to do it. And the GP sort of said, I think you're fine, you know, I'm not gonna, I've got other things to do, and I'm quite busy, and which is all true. They are overworked and they are massively overstretched, and so he didn't get the test. And it was ultimately, for him, it was okay, but it created this dilemma for him, which was like, well, how do I get a test done? Do I pay to go privately, which is quite expensive and very difficult, and I don't know if I should do that. And so we started the POC because we wanted to allow anyone with a smartphone to run a simple blood test, beginning with cardiovascular disease, because we felt like that would be the easiest way for people to do it, to try and democratize access and make it equal, so that we can allow people to test themselves. Because our view, I don't know whether you'd agree, but by having access to your biological information, that means that action can be taken.
I completely agree. However, Heart UK would not recommend home testing, cholesterol testing right now.
Yeah, the self-testing. You mean
self-testing? Is not recommended by Heart UK because, quite honestly, it's not good enough right now. So you do need to see a healthcare professional, go to the pharmacist. If you have early heart disease in your family, and by that I'm talking about parents, siblings having a heart attack or stroke or dying below the age of 60, then do please go to your GP and ask to be investigated to make sure you know your cholesterol number. And if it's above a certain level, which is total cholesterol would be 7.5, then you need to be considered to whether you have the inherited condition called familial hypercholesterolemia, or for the rest of this broadcast we'll call it FH.
FH, yeah, just because it's a bit of a mouthful. Exactly. So let's just take this opportunity. Let's just talk about some of the terminology, right? Because I think that there's lots of stuff that gets thrown around. So cholesterol, what is it and why does it matter? Or why should people pay attention to it?
Okay, so cholesterol is a waxy substance that basically, we need cholesterol, but only a certain amount. It's when you have too much cholesterol in your system that things start going wrong. And what happens is that the cholesterol starts to build up in your arteries. And then eventually it's built up so much that basically the blood can't flow through your arteries, and therefore you have a heart attack or a stroke. Mm-hmm. Why it matters is because, in fact, cholesterol is the second biggest risk factor for heart disease. So
after smoking, probably, or no?
Blood pressure is first.
Blood pressure
is first. Right. And then cholesterol. And cholesterol, so I joined Heart UK back in August 2010. And, I've seen cholesterol being a priority, and then it's been swept under the carpet. And then it's a priority again, and then it's swept under the carpet. And I've often called cholesterol the Cinderella of the cardiovascular disease, because actually it's just it's the poor relation of the cardiovascular disease.
Okay.
And in fact, it shouldn't be, because it's very serious. It causes heart attacks and strokes, and it needs to be taken seriously. And it is the second biggest risk factor. So the downside to cholesterol is the fact that you have to be tested to know it. Whereas with blood pressure, it's simple. You can do it at home. And actually, it is something that is very, very easy. Pop into the pharmacist, get that sorted. It's a couple of minutes.
Yeah.
Cholesterol testing takes a little more effort to know. But it's still just as important.
Yeah. And that's, and I think and so within cholesterol covers 5 things, correct? That's also, so people talk about cholesterol testing, it's generally five things. And why I think that's also something that might be worth explaining, because just measuring total cholesterol on its own doesn't necessarily give you the full picture, does it?
No. So what you need is and I would encourage everybody to really understand the numbers here. So it is your total cholesterol, it's your LDL, which is your bad cholesterol, and your HDL, which is actually your good cholesterol. So it is, and the more you hear about cholesterol, it's an interesting one, because a lot of people think that cholesterol is simple and straightforward. You just eat less fat and less cakes and biscuits, and that's fine. But it's far more complicated. Heart UK puts on an annual scientific conference 3 days every year, and have done for 30 years now. whereby we discuss cholesterol and lipids and the importance and the dangers, and of course educate everybody around, healthcare professionals I would quote, around this subject matter. So actually knowing and understanding the LDL is very, very important, because it's all about LDL. HDL is also important because there is a certain point at which it doesn't become protective anymore. So HDL generally kind of tackles your LDL to try and get it out the body, but it just, once there's too much, it just can't cope anymore. And then of course you have your non-HDL, which is your all your blood fats less the HDL.
Right. And understanding all of them is important, because they all effectively provide a much bigger picture, a much richer picture of what's happening inside your body, presumably.
Yeah, absolutely. And that's exactly the point, is the understanding of everything is really important. And often when people phone up for their test results, or they go onto their app, of course, of their test results, then they see the numbers. Often we hear on the helpline that people don't get told their numbers, they just get told you're okay. And actually it's really important, and people are taking responsibility for their health more and more these days, because of apps, actually, because of technology. So people are seeing, you know, what does that actually mean?
Well, I think people, again, partly one of the reasons why and with PocDoc, our first route that we're collaborating with is with healthcare professionals to try and roll out PocDoc through pharmacies and GP surgeries and so on and so forth, to provide that extra layer of support and sort of responsibility, if you like. But I think people, particularly with something which is a marker or a set of markers which is involved in a ongoing monitoring or an ongoing measure of ongoing health, then unless you have access to that actual data, then how do you sort of get a benchmark for whether you're going in one direction or the other, you know?
Exactly right. Exactly right. And I think this is exactly where technology does come in. So we have all got access now to our records, our doctor's records, if we wish, but there's lots of health apps out there, and people can choose which ones they want to do, link up their Fitbit to them, etc. And I think this is very important. Tech is definitely going in that way. And Steve, you obviously, as you've said, you own a tech company. So what way are you taking, you know, health?
So our kind of view on the whole thing, I mean, look, I don't want to, obviously I could talk about this for hours and have them, but the way that we came at this, or are coming at this, is fundamentally that if you want to encourage people to live a healthier life and to take more control over their health, whether that be cardiovascular disease or type 2 diabetes or whatever it might be, then I think the argument has sort of been settled that by giving those people access to information about their current condition, it makes it easier for them to make better decisions. I think it's kind of, I'm not sure really there's a counter argument to that. And so our view has really been around, how do we make routine blood testing easier and quicker for certain things? It's not about replacing the laboratory, but for certain markers, starting with a 5-marker lipid panel, PocDoc allows you to do that with a smartphone or a tablet. And we've just finished the NHS Digital Accelerator, where we were highlighted as HealthTech set to transform the NHS, which is hugely exciting, and we're in discussions for a number of NHS pilots. So we've been very conscious from the beginning to align ourselves with what clinicians would approve and would consider to be a responsible way to roll out this technology. And you know, it's very exciting. I mean, people, you know, there are a number of pharmacy chains that we're speaking to. I think the role of community pharmacy has a massive role to play in helping take the burden off of services that were previously, you know, within primary care, but actually now community pharmacy can take over a lot of that things if there's the technology. So that the reason why our kind of innovate, or one of the things that we believe is innovative, is this idea of being able to combine the benefits of using an app with a traditional lateral flow diagnostic. Right? Lateral flow tests traditionally are just silly bits of plastic that you have to read the result from, right? Not very good for quantitative, right? If you can read a line, thank you, COVID, but otherwise, how do you digitize that information? How do you do it in a safe, secure manner? How do you sync back up with someone's electronic health record? How do you provide people with access to follow-on care? It's actually really difficult if you're dealing with lateral flows, but it's very, very hard to offer point of care blood testing unless you use lateral flows. So we feel like we've sort of come up with a solution that combines the benefits of app technology with lateral flow, and that's what the PogTalk platform is. But we're very conscious that it has to be done in a way that's supportive for patients and aligned with what the healthcare service needs. And the needs in this area are pretty dramatic at the moment.
Absolutely. And I think I've always said science moves on in leaps and bounds very, very quickly. It's incredible what we can achieve these days with science, and how the history where we've come from and how quickly things happen in the current environment. And I think you've just demonstrated very ably in terms of what's so exciting about tech meeting science now, and with the patient always at the centre. This is always what Heart UK will always say, is the patient always at the centre, and it's always about that patient and the family, of course, always about the family too.
I agree. And so on that note, we're going to do a short commercial break right now. But after that, we're going to come back, and I'd like to dig into a bit more detail on all of on the core mission of Heart UK, and ultimately why people listening should care about that, because it's really important, and what you're doing across the board is extremely exciting. So we'll be right back after a couple of minutes.
How good are vitamin C supplements? Usually only a small proportion of vitamin C actually reaches your cells and has a positive effect. Whereas the high absorption levels of Goldman Laboratories liposomal vitamin C help maintain optimal vitamin C levels in your body and strengthen your immune system. Now get 10% off when you choose Goldman Laboratories liposomal vitamin C capsules. Just quote 10 off at goldmanlaboratories.com.
Do you suffer from pain? Laser, a home use CE-approved medical device for the effective treatment of pain, is now available in the UK. The results of a double-blind trial has shown that Cure Laser offers a significant reduction in pain compared to the placebo group. To get your special Cure offer now, call free on 0808 501 5122 or Google Radio Pro London. Cure Laser. Cure Laser.
Hello and welcome back to this week's HealthTech Hour with Jules Payne, CEO of Heart UK, which is the UK's only cholesterol charity. So, Jules, before the break, we were going to talk about let's return to the mission of Heart UK, which I think you expressed very eloquently at the beginning of the show. But how really do you move from what's an amazing mission statement to actually all of the different things? Like, how does that actually play out, in reality?
So how it plays out in reality really is about an awful lot of effort.
Yeah, I could understand that.
And a bit of heartbreak ourselves, actually, if we don't get heard. Right. This is very, very important. We have a network of ambassadors, amazing ambassadors around the country, who really help get the Heart UK messages into their communities, which is so, so important. And, what we try and do is, it almost kind of, you need to sit down at your dining table one day and just go, what are we going to do with this charity? Where is the strategy? And, yes, you always start with the person. It's not necessarily even the patient, because they don't know they're a patient yet.
No.
And, roughly half the country have got high cholesterol or raised cholesterol. 1 in 200.
Sorry, on that, the actual level is surprisingly low. It's 120 over 80, right? Is the borderline or is it 130 over 80? What's the borderline for high? Because I looked into this and I was actually surprised at how sort of low. It's lower than I thought it was.
Raised cholesterol is if you're over, I'm going millimoles per litre, I'm afraid. So if it's over 5, that would be. Actually, the recommendations don't state an amount anymore, but Heart UK still uses the old-fashioned ones purely to give somebody something to hang on to. So if you've got a total cholesterol of under 5, then, you know, that's fine. LDL should be below 3,
Yeah.
basically, and HDL above 1.
Sorry, I interrupted you when you talked about blood pressure, because I did my blood pressure the other day and it was higher than I thought it was going to be. And then I went on the NHS calculator and I was like, oh my goodness, I'm like borderline on the, you know, borderline on the orangey red bit. But anyway, sorry, carry on.
Yeah. Okay. So you're talking blood pressure, I'm talking cholesterol.
Yeah, so you
Can we
said
get back to cholesterol, Steve?
Yeah, of course we can. I'm sorry, my bad. Took a little detour there. Back at it.
Very much. Okay, so basically, what we've got here is we've got about half the country, estimated half the country, have got raised cholesterol. So there's a big problem out there, massive, huge. Within that, we've got 1 in 250 people, so about 250,000 people have got the inherited form. We only know 5% of these people.
Yeah.
Why? We're in 2022. We only know of 5% of 250,000 people that are ticking time bombs that need to be picked up early. Mm-hmm. So it all starts with policy. So it kind of starts with that in terms of, right, where do we go? Is cardiovascular disease a priority for the government? And then you can start with that government thing, but if you start with policy with the government, that does translate. And I'll give you an example of that. Mm-hmm. We have been championing for a number of years now. Since 2013, we have been championing a one place for data for FH data. Okay, so all families in future families, generations of families can feed into that registry. So there should be a national registry. And by national, with this particular thing, you have to think about all the different devolved nations that all have their own, or should all have their own. Okay.
That's great. It's great, isn't it, that it went that way? It's really helpful.
I know, wasn't it?
Anyway.
So we championed since 2013 that there should be a national registry for FH. Wales has it. They don't have it in Scotland, Northern Ireland, or sorry, in England. Sorry, I'll put my teeth in now. Anyhow, so in England, we don't have it in England either. And we have a sort of, but it's not really. And there's been a particular piece of software that clinicians have used, and it's sort of become the pseudo-national, but it's not really officially a national registry. So we've championed that with the government. And we have championed that with the NHS since 2013. And I'm really, really proud to say that Heart UK, because of Heart UK, what we received was a letter from the Secretary of State for Health. This was last year we received this, confirming that there was money set aside, £335,000 to be precise, set aside for the NHS to develop a national registry for FH. How proud are we that we got that? So we're feeding into that process, and that's great. So that sort of policy with the government into practice with the NHS. What does that matter to the families and the patients? Actually, what it matters is there's already a system. So whether it's going to be that same system or not that's going to be used in the future, we don't know at this point. But what matters is that actually patients will be on there. The data from today, we will know what gene, if we've identified a gene in a family, we will know that for the grandchildren, for the great-grandchildren, and for generations and generations to come. So that's the importance of a registry.
Yeah.
Now, that's something that Heart UK has done. We've also...
Can I just ask a quick question there?
Sorry, go
on. Sorry, I don't want to interrupt your flow, but on that, because what I think is really interesting, and we talked about this in our pre-production call, didn't we? Which is around why does policy advocacy matter? Like what versus, you know, I'm whatever, something that people might perceive as being more direct. And I think that that's a really good example of why it actually matters, because certain large systemic changes that is what you have to do. There's lobbying, there's policy, there's white papers, whatever else you guys had to do in order to just health economic case. I'm guessing probably somewhere along the line, you know, it's not easy, particularly healthcare policy, to change.
No, it's absolutely not. It takes years. It's not something, it's not a 5-minute job by any stretch. It takes years to get there. And it's really important to be part of that conversation. That's the key thing here, is being part of that conversation, making sure you know who the key stakeholders are that you need to be engaging with. That's really important point as well. And making sure that that dialogue is happening, and that that's happening regularly. And that also, it's not just that that's happening regularly, but you also hold them to account if they've promised something and it's not been delivered. That's really key. So we've got that in the long-term plan at the moment. So there is an NHS long-term plan for cardiovascular disease. And in there is a target to reduce heart attacks and strokes by 150,000 heart attacks and strokes by 2029. There's also, I'm pleased to say, this is the only 5-year target, thanks to Heart UK, published within the NHS long-term plan, is to increase the FH cases identified from 5% to 25% by 2024. That's
excellent. And there's only that, how do you think that they're going to go about doing that massive increase? Because that's a 5x increase, right?
Exactly. But this is the amazing thing. So, and it comes back to us holding the system to account again, not just the NHS, but actually the government, because, you know, this is the whole thing. It all interlinks with the government policy as well. So that publication is agreed. So we can hold everybody to account, saying, well, what are you doing about it?
Where's the funding to deliver
Where's
this?
the funding? The registry, absolutely a key part of that. So that's tick. Well, it's not quite tick because we haven't quite done it, but we're holding them to account on that. And Heart UK is involved in those conversations with those key stakeholders. That's really, it's so important, Steve, to make sure that you collaborate with the whole system and actually get through this journey together.
Well, I agree. And on familial hypercholesterolemia, or FH, that's actually one of the areas that we're in discussions with Barts Hospital about, in terms of how we can use PocDoc to better identify FH patients and monitor FH patients and things like that. And I think the thing with FH is that you're right, it's a complete ticking time bomb. But if you can get those people, if you can identify them, then they can be treated very easily, you know, relatively cheap.
Absolutely.
Statins and other things, but it's the not knowing that is creating the problem. And to your point earlier, yes, they're numbers on a piece of paper, but ultimately there's more than that, which is not just the death, but it's the shockwaves that go through the family. So, you know, as we talked about before, my father had a stroke that was caused by cardiovascular disease when I was 14. He survived with quite severe you know, after effects, but more than that, it was the shockwaves that rippled through the family that still have repercussions today, you know, in terms of the damage that single event had. And so and that's been replicated millions of times a year up and down the country. And so anything that can be done to try and stop someone having that initial thing, but actually there's a whole bunch of secondary and tertiary, you know, negative impacts and follow-on issues that come as a result of that one particular incident.
I completely agree. And I have to say, the NHS has responded brilliantly to the long-term plan. And as far as the cholesterol targets that are in there, there's a lot of activity that's happening, and there's some fantastic stuff going on, not least of which is for FH. There's numerous ways that need to be identified and delivered in order to deliver that target in time, let's say. So basically there's going to be child parent screening, which I'll come back to in a second. GP searches. So GPs would do a search on their database because they've got very rich data, and they will have patients there that will have FH in their GP practices, but it won't be too onerous on them because actually there's not a humongous number within each GP practice itself. So that's a really good way of finding families in that way. But then there's also the existing cascade testing services that are absolutely key. So once you've been identified, your then wider family needs to be tested. for FH and treated as appropriate. And I'll come back to child parent screening now. So this is something that we have been championing at Heart UK since 2016. So in 2016, there was a paper published by Professor David Ward, and in his study, they tested 10,095 babies or children between the age of 1 and 2 at immunisation point. And it's a simple heel prick test and cholesterol test. And then if the child had high cholesterol, then the parent or one of the parents, you've either got one or both in the surgery at the same time, the parent was then tested. And then 40 children and 40 adults or parents were identified, and then obviously families from there. And a great example of that is a young family down in Cornwall. And so Harrison went along for his immunisation, and his mum was asked, how would you feel about Harrison having this test and being part of the study? And she agreed with this. So Harrison was identified with FH. His 2 sisters were identified with FH, and bearing in mind the younger sister, at the time, I think there were 4 and 6, I believe. The younger sister had a cholesterol level of 13.
Wow.
Yeah. So
Wow.
then mum was identified, grandmother, the uncle, and some of the uncle's family too. So you can see the importance of doing this, but not just doing this in terms of identifying the families, but doing it early has been so important. Now, this family, a hugely positive family, they've been identified, they know it. The treatment for Harrison is still diet and lifestyle, and medication is required for everybody else, as well as a healthy diet and lifestyle, and that is key. And they're getting on with their lives. How amazing is that? Now, for child parent screening, for us, this should be something that the UK National Screening Committee absolutely should adopt. Now, of course, our UK National Screening Committee go across the whole of the UK, not just England. So I'm pleased to say that at the moment, where we're at with this is there is a pilot with child parent screening in England, across 7 areas of England. So if you're invited for your child to have a test, because your GP practice is involved in this pilot, please say yes. Heart UK's got lots of information and support for you if you need that. But I would say that also, if that's a success, the pilot is a success, and the target for the pilot through the NHS is to test 30,000 children in the next 2 years. And that pilot actually started testing children in October and identified the first child, I believe, in December. So that's a huge programme. The UK National Screening Committee has said no 3 times to accept adopting this as a screening programme. So
was that a cost decision, or what was the?
No, it was the fact that you wouldn't necessarily treat the child until older. Well, actually, diet and lifestyle is a treatment.
I mean, how can it be bad to just find out?
I know.
I mean, like even if you don't do anything, how can it be bad to just understand the situation?
Exactly. This is true prevention. It's a true prevention program. They are bonkers to say no to this.
I mean, look, I could understand if there was because people in the NHS, I think one of the things that if you're not from the area that we work in or connected, it's difficult to understand that the NHS and the wider NHS is effectively what they call a fully costed enterprise. So there's no sort of money set aside to do new things. If you want to do a new thing, then it comes from stopping something that's already happening, or in theory, the new thing saves money so that actually it can kind of happen and replace whatever the old thing was. So I could understand if the argument here with the screening was actually relative to other things that we might want to screen for, this is less cost effective, or the cost benefit analysis didn't quite get there. But if it's more of a ethical thing, or we don't think the information should be shared with parents, it's like that's absolutely bonkers.
Yeah, it is utter bonkers. So at the moment, we're in a situation where there's nothing we can do right now. What we have to do is wait for the evaluation of the pilot. And then if that pilot is successful, then the NHS will roll it out throughout England. But what about Wales? What about Northern Ireland? What about Scotland? That's why I want the UK National Screening Committee to say yes. And there's other aspects to why they've said no. It's not just been one reason, but
Sure.
What Heart UK is trying to do is, initially they said, well, there's no guidelines for children. So we actually put our heads together with the key stakeholders, healthcare professionals, and Heart UK published guidelines for children and young people for FH. So we will fill any gap that the UK National Screening Committee have. What we can't do is say, what you can't really do, because it's not ethical, is to say, if you put children on treatment for this amount of years, then they will, you'll give them so many years. It's not ethical to do that, because you can't do a control trial with that.
No.
So,
but is this, again, I don't exactly know the specific diagnostic test that they're doing, but this sounds like something that could be done at community pharmacy level. If it's a heel prick blood test, this is, in a weird way.
I have to say it could be done. So what normally happens is at pharmacy level, pharmacists clearly have a very important role in cholesterol testing. There's absolutely no reason why the cholesterol testing can't be done. Normally it's done with point of care testing. So that's your indication that there's a problem. And then you go and have a full blood count test through your GP. And then the GPs, searching for FH at GP level is important. And then for cascade testing, that gets referred through to the specialist centres for cascade testing of the family members. But the key thing here for me is this stuff saves. This saves, not just saves lives and keeps family together, it saves a huge amount of money, because once you've identified if there is a gene that's causing the FH in the family, then actually you only need to look for that one gene. So you're not paying for a whole panel of gene testing. You're paying to only look for that one gene. So it's money saving on the NHS as well. So this is an absolute no-brainer.
I'm obviously slightly biased, but it does sound like a no-brainer to me. So look, we're gonna stop for our last and final commercial break. We'll be back in 2 minutes for the final part of this week's HealthTech Hour. Speak to you in a second.
Ion Gut triggers the body's natural ability to support gut strength all year long, so your immune system can protect you when you need it the most. How are you treating your inner armor? Visit uk.ionbiome.com to learn more. Ion Gut. Protect what protects you.
Hello and welcome back to the last part of this week's HealthTech Hour on UK Health Radio with Jules Payne, the CEO of Heart UK. So there's a few things that I want to make sure that I cover off with Jules, because after we do I think everyone listening generally knows that we put a fair bit of effort into kind of scripting the show and writing question sets and things like that. And then generally, when you get a fantastic guest like Jules on, it all just goes out the window. And then, you just have a great chat. So I just want to make sure we cover off a couple of things. So the first one is, let's talk about the pandemic. So what, if anything, has the pandemic changed in cardiovascular disease assessment, prevention, treatment, cholesterol testing? Like what have those key changes been? Because obviously everyone sees backlog, you know, all that kind of stuff in the media. But what, from your perspective, has the pandemic impacted?
I think the impact, first of all, I would just point out that yes, delays, etc. 1.2 million missed health checks. That's 1.2 million people that did not know whether they've got a problem with their cholesterol. So 12,000 extra heart attacks and strokes in the next 5 years is the knock-on effect of exactly that. So absolutely, we need to do something about it. There were 5,600 more CVD deaths than expected in 2020. So massive. But we have an opportunity, Steve. This is the point. We have an opportunity. What happened with the NHS, clearly, it was so overrun with the pandemic, and in some areas still is, even though obviously with all the changes recently, with the requirements, but I'm still hearing that there's an awful lot of issues with COVID around the country in hospitals. But the whole world pivoted to digital and new ways of doing things, and I do not think that's ever going to go back.
Genie's not going back in the bottle.
No, it really is not going back in the bottle. But I would point out that whilst digital and technology is absolutely key and important here and plays a hugely important part in health, it's not for everybody. So we always have to balance that up and make sure that we are actually covering everybody. I mean, from Heart UK's perspective, we want to make sure that everybody gets the support that they need. And that's every single individual in the UK. So tech is important. It has its place for sure. And I do think that with the pandemic, it's definitely demonstrated to us that tech is here to stay. Tech has an important part to play in health. But as you've touched on, and I've touched on as well, collaboration is absolutely key to work together to get this right.
And it should be about, my view's always been, again, like you say, it won't be for everyone. And the demographic that it's not, quote, for, there's probably some generational, you know, demographic shifts that mean that percentage is smaller, but it's still always going to be significant. And digital really is just a channel of delivery in a sense. Now, it obviously has been like decades worth of change in the space of 2 years, which is, some may say, long overdue, right? It was stored up and it should have already been happening, but wasn't for various reasons. Inertia is quite hard to overcome. But you know, it's a delivery mechanism, it's a delivery channel where if there are cohorts of people that can have their services delivered digitally, great. And if they're happy with that, great. And if the outcomes are good, then fantastic, because that frees up time for other people or other diseases or conditions that just don't or aren't suited to that delivery mechanism.
Yeah, absolutely. I completely agree. And, you know, it's about making sure that you are in the right place at the right time for each individual. And that's the key thing. And Heart UK, we do an awful lot digitally. But we do have still physical booklets and so on. So this is important. We still have physical people that are ambassadors that are in their communities helping us to get our messages out there and to help raise awareness of this very important subject matter.
Agreed. And so a kind of continuation on that, what do you think that the potential impact on cholesterol testing or on cardiovascular disease of you know, digital point of care testing or app-based point of care testing, stuff like what PocDoc's doing? I mean, what is your kind of gut feel about what that could be used for and how that might work out?
Well, people want to know more about their health. There is a huge interest out there of individuals' health from everybody. And, you know, the health conversation, certainly the pandemic has helped with that. And one of the reasons why our helpline was so, the increase with our helpline was so huge was because people wanted to know and try to understand what was the impact on them, because with cardiovascular disease and the pandemic and COVID, what was actually going to happen to them. What was their risk? What did they need to do? They needed to understand more. And I think what it's done, the pandemic, is to make us think about our health far more on a day-to-day basis than perhaps we did before, because life takes over. You get on with your family life and your job and so on and so forth. And health sometimes takes a back seat.
Well, I mean, it does over the last couple of years, mostly because if anyone was worrying about health, it was probably about COVID, and then otherwise everyone was just trying to keep their head above water.
Yeah, exactly. And I think that's, but what it has done is brought to the forefront of everybody's mind their health, and certainly there's always been an interest in health, hence our helpline, but I think even more so now, and I think people are turning to tech to help them, because let's face it, it's, there's enough to deal with in life, let alone adding to it with health difficulties. And if you can use if you can use health tech to help you manage all of that, then I think that's the future in terms of whether it be apps, whether it be testing. And I would just reiterate that Heart UK does not recommend home testing at the moment.
Self-testing, yeah.
But that could be something that, if there's a test that's good enough out there, then, come on, Steve.
Yeah. Don't worry, we're working on it. I mean, look, fundamentally, the first stage for us is obviously working out through professionals. Like that's the first stage, and we're confident that we can move to a point where, but look, it has to be able. With medical devices, we're a medical device developer. There is a huge burden, quite rightly, of responsibility on us to ensure that our test can be used correctly in the environment and use that we intend it to be. So we'll get there. But
I think and it is important, because it isn't just about those results either. It's about the what then.
So exactly, and so what? Yeah, it's the so what. And again, like we talked about before, is like sometimes even when people go to more traditional healthcare outlets, healthcare providers, and they're told, oh, your results are fine. So, well, what do I do? What do I do with fine? Good, bad? Where's fine?
And so I think exactly where Heart UK is. So we are there for patients as well as healthcare professionals, to help provide help with the individuals and their families, to help them to understand their numbers, help them to understand what they can do about it. And this is absolutely key, that diet and lifestyle is very, very key, but treatment will be needed for some people if you can't get it down with diet and lifestyle, and especially if you've got the inherited form, treatment is needed.
So on that, just that specific point, because we've talked about FH quite a bit, if someone has some concerns about FH themselves or in their family, what can they do at this point in time? What would you recommend that they do?
So first of all, go and have a look at the Heart UK website, so heartuk.org.uk, and we do have a helpline that is available for you. The details are on the website. Follow our social media channels. We're on Facebook, Twitter, Instagram, the usual ones. And I would just say we have a humongous amount of information on the Heart UK website, not least of which is tons and tons of fabulous, really tasty recipes. So even though you might have
I can vouch for that. I took a look. They do actually look pretty good.
They are fantastic, and they're beautifully written, easily understood. And let's face it, I'm not a great cook, but if I can actually cook these delicious dishes and make them delicious at this end, as opposed to our dietitian who beautifully puts them together at her end, then actually that's good enough, I would suggest, because I'm not a great cook. But they do turn out beautiful. So there's lots of things that you can do, and just bear in mind, also on the Heart UK website, there's information about foods that you can introduce into your diet that will also help reduce cholesterol levels. And please be aware, it is Heart Month in February.
It is National Heart Month. It is
National Heart Month. So Heart UK has got a cook along on Friday the 18th of February. So if you wish to sign up for that would be great. So,
and what is that? What's happening with the cook along?
So it's a cook along that is cooking tandoori roast salmon with coronation, cauliflower and brown rice.
That sounds actually pretty good.
And Loch Duart is supporting us by providing the salmon, so that's beautiful.
Very nice.
So during Heart Month, we're just encouraging everybody to take notice, so be informed about cholesterol, be active, so sign up for the Heart UK 10,000 Step Challenge. Learn to cook, use our recipes, join our cook along, and of course please do give. We are a charity and we would be so grateful if you could make a donation to help us to keep prevention at the forefront of the mind of the government, to keep things active and moving forward with cholesterol, and so to help us to help other people and families such as yours, as your listeners are listening. That would be absolutely amazing, and most of all, to keep families together.
Yeah,
that's absolutely key.
And on that note, what do you think the next 12 to 24 months really holds for Heart UK, other than National Heart Month? But like, what's the sort of, do you have any kind of big goals or objectives that you're trying to work towards over the next 12 to 24 months?
Absolutely. That is for the long-term plan to be delivered. Clearly, that is for our education programs for healthcare professionals to get every healthcare professional onto those, to get them fully educated around lipids, but most importantly to crack cholesterol, but to collaborate on tackling cholesterol together. And making sure that we save lives and keep families together. Great.
And before we go, what would your advice be to anyone who's kind of already working in the charity sector or thinking of moving into the charity sector, sort of similar to what you did? What advice would you give them?
I would say go do it, because quite frankly, it's the best thing I've ever done. Although I have to say, I'm really sorry, but I have the best job in the world. That's not available.
Yeah, no, I agree. Well, look, Jules Payne, thank you very much for coming on the show. Jules Payne, CEO of Heart UK. It was a fantastic show. I loved having you on. I'm sure the listeners did too. So thank you very much for coming on. And thank you to everyone for listening. We'll be back again with another great guest next week, but have a lovely week, everyone.